that is an ongoing conversation currently. So you're all very much welcome. I would like to encourage everyone to please introduce yourself in the chat section, because earlier on we had a situation where we had and we were worried a little bit. So it's important that we know everyone who is on the call so that we can be able to hold ourselves accountable, but also hold everyone who is on the call accountable. And so I'd just like to double check right now that we have all our participants or all our panelists on the call. So in case I call out your name, please just confirm that you're on the call with us. Sarah Jessica Agwang, please confirm that you're with us. Dr. Olive Sentumbwe, please confirm that you're with us. Dr. Roswitha Premsa, please confirm that you're on the call with us. Miss Elizabeth Kemigisha, please confirm. And finally, Mr. Joel Chiwanuka, please confirm that you're with us so that we can be able to officially start today's conversations. So you can confirm by saying hello, or you can post in the chat section and say you're on call so that we can be able to panelists, are you available? Panelists?
Isabella, at the moment, we I don't pass. Let me just check.
Yes.
Let me just check that people who are
help
there.
me check in with them, because as soon as we know that we have everyone on call, or at least the first panelists, then we can start today's conversation without having to break it up.
Okay. Not yet.
And for our participants, please bear with us for about 3 minutes, and we should be able to officially start at.
Okay, yes, there is one. Dr. Roswitha is already there. Bella?
Yes, yes.
Dr. Roswitha, she's one of the panelists. She's already there.
Okay. Okay, since we have Dr. Rosita, I believe that we should not hold, we shouldn't hold participants waiting, considering that we put out the invitation for us to start at exactly 11. So I'd like to encourage one of the people at the Secretariat to please follow up with Dr. Olive Sentumbwe, Miss Elizabeth Kemigisa, and Mr. Joel Chiwanuka. That notwithstanding, I would like to officially invite and welcome all of you to today's side event on women, water, and the care economy. And today's conversation is going to highlight national advocacy issues regarding accessibility, availability, and affordability of water as a human right, an economic resource. But it's also a discussion today that is going to look at the issue of water and the care economy and its impact on, looking at the issue of water and its impact on the care economy, especially during the COVID-19 pandemic. Now, for participants who may not be aware, the Uganda Women's Network has held a series of conversations around water and the care economy that has brought on board stakeholders in the water community, but it's also brought on board technocrats from different. It's brought on board policy analysts to ensure that a conversation around water, its availability and accessibility, especially for women and girls, is one that gets into the dialogue discourse in this country. And so I am glad that I am part of yet another conversation, which is a very important conversation, especially in the context of Uganda, but also in the context of Africa, where we are looking at how the care economy is very much affected by the availability and also accessibility of water, not just in urban communities, but also in rural communities. And so today, our program shall look at 5 key conversations. The first conversation, and I hope that all of you had an opportunity to access the agenda. The first conversation shall be around influencing policy and practice for women's representation, leadership and participation in water service delivery. And Ms. Sarah Jessica Agwang, who's the Director of Programs at the Uganda Women's Network, shall be taking us through that. After her conversation, we will have an opportunity for any questions from participants. We will then move into a conversation around water and sanitation as a prerequisite for women's health and well-being for the attainment of gender equality health organization, leading on that discussion. After a question and answer session, we will then go in and have a conversation on the role of development partners in financing for water and environmental conservation for sustainable development. And Dr. Rose Witter from the head of, who is from the Austrian Development Corporation, shall be taking us through that discussion. After which we will go into a conversation around interrogating the gender responsiveness of the national legal and policy frameworks and how they influence women's equitable access to safe water. And that will be done by Miss Elizabeth Kemigisa, who is from FIDA Uganda. We will close today's policy conversations with a discussion on integrating unpaid care into government policy, planning, and resource. And that will be done by Mr. Joel Chiwanuka, who is a principal sociologist at the Ministry of Water and Environment. I would like to encourage us to listen very keenly and take note of your questions, but also make use of the chat sections and keep the conversation going, or ensure that your questions are posted there. In the event that you would like to ask a question of the reactions comments, so if you look at your screen, there is provision for reactions, and if you click it, there is an opportunity, an option for you to raise your hand. So in the event that you would like to participate in voice, please use the raise the hand option. And once you have been selected, please go back to that option and lower your hand so that we can be able to use, to select yet another participant. I would also like, in terms of housekeeping, to encourage each and every one of us to keep our microphones on mute so that we do not have feedback from your side. I would also like to encourage that unless necessary, please keep your videos off, especially if you're from Uganda where the internet connectivity is very limited. And so putting your video on might affect the quality of conversation as we go in. That notwithstanding, without wasting time, I'd like to invite Miss Sarah Jessica Agwang from the Uganda Women's Network, who will be leading the conversation on influencing policy and practice for women's representation, leadership, and participation in water service delivery. Sarah, you're very much welcome.
Thank you, Isabella. But I think Susan will first give welcome remarks, and then I'll come in after her.
Okay, thank you very much for the guidance. Let's have Susan come in and give us opening remarks. Welcome, Susan.
Hello, everybody. My name is Susan Achen. I work with Uganda Women's Network, where I'm the program coordinator for women's rights and access to justice.
Have we lost Susan? Have we lost Susan?
I think she has dropped off.
Okay.
Let's just give her like 1 minute.
All right, let's give her a minute to come back on so that she can continue submissions. As Susan comes back, I'd just like to encourage everyone to please introduce yourself in the chat section, but also the Uganda Women's Network shall be sharing a registration link on the group chat. So when that link comes in, please take the opportunity and fill it in, because we would like to know who was part of this important conversation. Susan, are you back? Susan? Okay, since we don't have Susan and our time is also far spent, I'd like to invite Sarah to continue with her submissions. We will provide for Susan Sentumwe. It's lovely to see you here on the call. Over to you, Sarah.
Okay, thank you, Bella. I'm trying to see how I can be able to share my screen because I have a PowerPoint presentation. But I think because of the hackers, I have been disabled. I can't easily share my screen. Just a minute, I'm trying to see if I'm not able to, then I'll just. Can you see now?
Yes, we are able to see your screen. Please go ahead.
Okay. Good morning, ladies and gentlemen, and welcome to UWONET's side event for the CSW66, where we are talking about women, water, and the care economy. Thank you, everyone. Thank you, our panelists, for joining in. Like maybe Bella has mentioned, for this year's CSW CSO events, they are virtual, given the fact that has affected the way we used to. So this time, the committee decided it will still be virtual events for this year. And UWONET registered to be part of this. And this activity, we are co-hosting together with Uganda Information, our long-time partners that have supported the women of Uganda for quite a long time. We've this point is for women's representation, leadership, and participation in water service delivery. our experience as UWONET. So at this point, I'm going to take off my video so that this presentation is not affected. And yeah, because the network can be funny if you have video on. Okay, so just to state that unpaid care and domestic work sustains families and communities on a day-to-day basis from one generation to the next. I've started with that statement because the gist of what we're talking about here today is on how we can amplify issues of unpaid care, but linking it to the issue of water. It makes a significant contribution to economic development by nurturing people who are fit, productive, and capable of learning. And also these people are capable of being creative. Yet unpaid care remains invisible, undervalued, and neglected in economic and social policy making. In most cases, people think that that is not work. Even when you ask women themselves, what do you do? They say that I do nothing because of the mindset that we have, that this heavy work that we do at home is not work. So even in terms of economic and social policy, it's still invisible because we haven't yet appreciated the unpaid care work as work. Its distribution is grossly imbalanced. Globally, women do 3 times as much unpaid care and domestic work as men. So such work include fetching water, collecting firewood, cooking, caring for the young ones, sick and elderly. If you've ever cared for an elderly person, that's when you will know the burden of caring for such people. It's really, really difficult, and you cannot balance the other work that you have to do if you have an elderly or a sick person that you're taking care of. So fetching water is a core element in women's unpaid care work. It's one of those activities that women have to do every day because we need water every day in our families. So in many countries, like Uganda, collecting water is a key gender role in the community and is mainly assigned to women and girls. The water collected is used for drinking, washing, cleaning, among other uses. And of course, this maintains the family. Women have a major stake in water in terms of the daily collection of water, the storage of water, the management of household water. It still remains predominantly a domestic care responsibility for women and girls. And they have intimate knowledge about water sources, about the quality of water, and the daily household water requirements. This role, basically, society has assigned it to women. So Ugandan women and girls face some of these challenges. You know, they spend 5 to 6 hours walking an average of 3 miles every day simply to collect water. I know most of us have different statistics given the different experiences. In some places, it's shorter. In other places, it's longer than this. Besides walking, They also queue several hours at the borehole, at the wells, waiting for their turn to fetch water, especially in dry season. This becomes worse. At times, women have to go to line up for water at night. And even this exposes them to other dangers. For example, they can get raped, they can get beaten up, but also risks of moving at night. Of course, the risk of violence is there because they walk for long distances, to look for water, and then along the way, they are exposed. One of the challenges. Okay, so one of the challenges is around the education outcomes linked to water. So you find that children tend to be worse in class because of issues of water, especially girls. Because of the care role that they have, the girls have to first go fetch water before they go to class. And of course, when you go to class late, when you're thinking about fetching water, your results may be worse because you're not concentrating in class. Also, another challenge is the health of women and girls is compromised because they have to carry many liters of water on their heads or backs, and carrying heavy weight for long distances causes back pain. I know Dr. Olive will expound more on this point because she has more experience in this area. But of course, also the issue of the disease burden within the family due to poor sanitation increases the care and domestic work burden to women because they are the ones who take care of the sick, So the work still becomes more when the disease burden is high in the family. Consequently, women living in places where more time is needed to collect water tend to participate less in income earning market-based activities. Yes, because you want to go and sit in the market to sell, but you're thinking of walking a few miles to pick water, then go to the market. At the end of it, you just give up. You say, no, let me just leave the issue of earning an income and let me concentrate on my domestic chores. However, the effects of climate change have also increased incidences of drought, compounding the problems faced by women. So the challenge becomes more, especially in dry season. The nearby wells get dry, the nearby boreholes, also the water level goes down. So women have to find alternatives to water. And yet at home, they do not have proper storage or water harvesting facilities. Because we are talking about boreholes and rainwater. When you talk about tap water, that's another story. It's not common. It's mainly found in town water, projects, but someone who is in the village, that's not the experience they have. But of course, I would like to talk about the issue of COVID and how it has exposed the issue of unpaid care and domestic work. The COVID context has shown that the economy depends on women's unpaid work. The COVID-19 pandemic and lockdowns exposed who is doing what at home. I think all of us were able to experience this. You could visibly see the work that the women were doing during this time: cooking, cleaning, caring for their children, the elderly people, collecting firewood, which at most times is often not considered as work at all. But the current economic system only survives because there is a care economy underneath sustaining it. You know, for you to be able to wake up to go to work, there is a support system at home that is helping you, ensuring you have food on the table, ensuring the kids are taken care of, your clothes are well washed and ironed. You know, everything at home is okay for you to be able to deliver. But then this care economy is not recognized. It needs to be recognized. It needs strategies towards reducing it, because it's only bent towards one side, and that's the side of women and girls. So my 10 minutes are almost over. I would like to talk about our experience as UWONET, our work in terms of amplifying women's participation, women's leadership in terms of water. So basically, I'm going to share our work in northern Uganda in the districts of Kitgum, Pade, Lamu, and Agago. What have we done? Given the fact that we saw that there is a challenge of access to water. One is UWONET has enhanced capacity of 320 women in the water user committees. So water user committees is a structure for management of water sources or boreholes that has been established by the government. So there are guidelines for establishing a committee, which also stresses the fact that women have to be at least more than 50% in the composition of the committee. But then our advocacy has been that it's not about just being in the committee, but taking key leadership positions in those committees. So we did a training on their roles and responsibilities, leadership and advocacy. Also supported monitoring of water service delivery using a tool we developed. And this is done by the community watchdogs. So this is a separate group of people who monitor how services are delivered within the water points. Because during the training, there are certain areas that we agreed as action areas. So the watchdogs monitor, a report is compiled, and then these reports are used during the community water dialogues, which are interfaces between duty bearers and rights holders. So issues of boreholes that are not repaired for long, issues of non-functional community, water user committees, all these issues come out during the dialogues. And of course, we work with the community development officers of those respective sub-counties to see how we can address the issues that have been raised. We have also enhanced capacity of district technocrats on gender responsiveness in the water sector. And this was specific to technocrats within the water sector. What change have we seen? In terms of composition of women in the water user committees, we have seen that the ones that we have worked with, the composition now has moved to 70 to 80% in most of the water sources. I'm not saying all of them, but most of them, women have taken leadership positions. The chairperson is a woman, secretary, treasurer, because they have to collect monthly fees for maintenance of the water sources. So women have taken charge. And the difference that we have seen is those water sources where women have taken charge, they are sustainable. Like they take long working. Even when they get spoiled, they are easily fixed because the leadership is strong and the leadership knows how important water is to them. Women and men together recruited as hand pump mechanics. So we've been having advocacy around the fact that let women also be recruited as hand pump mechanics So these are mechanics who repair boreholes. If they are minor repairs, they can easily repair for the community. So these were trained by government, and they have tools that they are using for repairing the boreholes. But of course, in all the districts that we work, we discover that women form less than 10% because of other reasons, like some of them, their husbands are not comfortable with the kind of work they do, but also the work is so manual. So some women, when they, for example, when they conceive, they opt to stay off of that job. But of course, the advocacy has been there for more women to be recruited as hand pump mechanics. Also, we have seen hand washing facilities for the water points have been established with a timetable drawn for keeping the water source safe and clean. Because in most places in the village, when you go to the water source, you find that if there is a weak committee, the water source is also very, very bad in terms of the sanitation around and the hygiene. So in addition, the non-active water user committee members were replaced. During those trainings, we were able to replace some, because you find others, maybe someone moved on, others passed on, but then we worked together with the community development officers to ensure that those ones who are not there or who are not functional are replaced. Also, the other achievement is most of the water sources are now fenced. It's one of the issues that we task them as action points for them to ensure that the water sources are secure. Management and accountability of water fees streamlined, because there's been a challenge of how the water fees are managed. People pay monthly fees, but when there is need for repair of a borehole, there is no money, and then it remains non-functional for a long period of time. Of course, the reshuffle of committees has also made the management better. We have also done national advocacy on issues of water, making it visible for policymakers to notice the issues. In 2016 and 2018, we held the water walk in the capital city in Kampala. It was an advocacy towards availability, accessibility, affordability, reliability, and quality of water. This event showcased women as important stakeholders in water management and demonstrated their key role in water conservation, harvesting, and management of water sources. During that time, we handed over a petition to the Ministry of Water and Environment with our different asks and demands. In terms of policy influencing with governments, ministries, departments, and agencies, and Parliament, we have worked towards issues of recognizing that there is a burden, and then around redistribution, to see how do we redistribute this burden that women have, reduction, how do we reduce, what strategies can we put in place as MDS, as Parliament, towards reduction of the burden that women have, and then representation of unpaid care and domestic work in budgetary allocation. This advocacy is still ongoing because we are yet to reach there. So these are some of the pictures of our national advocacy, the water walk that we held in 2016. This is where we're handing over our petition. To conclude, in terms of recommendations, one is for government to strengthen women's involvement in the water user committees, because they are the ones who who interact more with water. So they need to be so much involved in the management of the water sources for sustainability, because our experience has showed that where women are taking lead in terms of managing the water sources stay longer. Ensure the water user committees are formed, oriented, and functionality monitored. So the challenge has been around monitoring functionality. Of course, this is a role that even civil society is supporting government in, to monitor functionality of the water user committees. Invest towards approaches that redistribute and reduce the care and domestic work. So we want more access to water. The other recommendation is invest in accessible basic infrastructure and time-saving technology for water harvesting and storage. This needs to be introduced to different groups of women in the community so that we're able to have simple, basic technology in terms of harvesting and storage of water. Because one of the challenges we've discovered is women want to store water, but they cannot store. So you have to fetch what you can use for a day. And then again, tomorrow you have to go because the storage is very poor. And of course, now that becomes a burden because every day you have to go. But if you had to go for one day, store the water, and then rest for the other day, like that, it would be a step towards reducing the burden. In terms of climate change, we recommend that government implements existing mitigation and adaptation strategies for climate change, such as tree planting. It's ongoing, but we need a massive plan, which is very comprehensive and covers the entire country. Thank you. Over to you, Isabella.
Thank you very much, Sarah, for submitting, and I hope that a lot has been learned on how, as a country, we are dealing with influencing policy and practice around water service delivery. I'm always amazed at the work that is being done at water user community level, and I applaud the Uganda Women's Network for the work that is being done. We have eaten into the next speaker's session, and so I'm going to ask if there are any questions or comments, and I'll just take one or two submissions, and then we should be able to move into the next session. In case there are no questions or comments, we will move directly into the session. And for those of you that asked for the presentation, I believe that Sarah will be happy to share that presentation so that we are all informed about the work that is being done by the Uganda Women's Network. Do we have any participants who would like to submit? Any participants who would like to submit? Okay, since we don't have any participants who would like to submit on Sarah's presentation, I will go straight ahead and introduce our next speaker, who is Dr. Olive Sentumbwe. Dr. Olive works in the family health, and she's the family health and population advisor with World Health Organization. Dr. Olive holds a bachelor's degree in medicine and surgery, and also has a master's of medicine, obstetrics and gynecology from Makerere University. Interesting about Dr. Olive is that she's worked as a medical officer in the Medical Missionaries Hospital in Chitovu. She has worked in Mulago Hospital, but also she loves writing guidelines for health and service delivery, and she has also worked with non-governmental organizations over the years. She has previously served as the president for Women Doctors, as the vice president for the Uganda Medical Association, and also as the chairperson for the Lady at St. Joseph Chaplaincy in Mulago Hospital. She sits on a variety of boards that include the White Ribbon Alliance, Mary Stopes, Uganda Health Ministry, and the Private Midwives Association. Outside of medicine, Dr. Olive loves mixed farming and also has ventured into the hospitality services. It's always amazing to hear about the vast things that women are doing, you know, both professionally but also outside their everyday 8 to 9 jobs. And so I don't think there is a more qualified person to have a conversation around water and sanitation as a prerequisite for women's health and well-being for the attainment of gender equality than Dr. Olive Sentumbo, because she brings on board the medical and health lens, but she also adds to this conversation the flavor of the very many things that she does outside the medical field. So without wasting any more time, Dr. Olive, you're very welcome to this session. You have 10 minutes and you can start now.
Thank you very much, coordinator, and I'd like to thank UWONET and the entire team that is in charge of this process today for the opportunity that you've given me to discuss and really join the entire process of talking about water as a prerequisite for women's health and well-being for the attainment of gender equality. As we have all agreed, we a United Nations General Assembly resolution that recognizes that the right to safe and clean drinking water, which is essential for the full enjoyment of life and all human rights which exist. So it is from that angle that I'm going to submit the few thoughts that I have about water and really women's health. From the past presentation that has been done, we do agree with the presenter that clean, safe water needed at all times, beginning with the simplest basic requirements of life, and that is drinking safe water in homes to avoid diseases that are transmitted through dirty and contaminated water, especially when communities do not have adequate water within their vicinities. We must also recognize that for women's health and their health to be there, water is required to prepare the food. That is a basic need for everybody to be healthy in a home. We must also remember that as we get up every day in the morning, we actually wash our faces, we brush our teeth, and we bathe using water. We must also recognize that for women in particular, we require a lot of water, especially during women's menstrual days. So we really want to affirm that clean water, safe water is needed in our day-to-day, minute-to-minute activities, whether at home, in workplaces, in institutions. Water is probably number one item if we are all going to keep healthy, whether we are men or we are women. It is also important for us to recognize some of the diseases that are actually linked to unsafe, dirty, polluted water. And for many of you, you have heard about some of the common diseases, but also uncommon diseases that people keep mentioning every day. We have cholera, which you know is really diarrheal diseases, which can be fatal and which is common even in Uganda, especially during this rainy season. So we must always keep alert to make sure that we do not get into contact with contaminated water, dirty water, But we also know that diseases like typhoid are also linked to dirty water, especially when it's not enough. People share very many types of behaviors to make our water and sanitation processes contaminated and therefore spread diseases. But there are also those diseases which are not commonly talked about because they are occurring in some communities and not all. But in Africa and also in Uganda in particular, there is a condition which is spread in our soft tissues, which comes from women getting into contact with water which has been contaminated with a certain organism, Schistosomiasis hematobium, in our water. When they go to collect water or wash clothes for the family, some of them get in contact with it. And it is rarely diagnosed in most of our health facilities because we rarely think about it. And it is seen in women presenting with various conditions which look like other conditions. It can present with a vaginal discharge, a bloody discharge, bleeding after intercourse or spotting. It can cause you itching in the genital area or burning sensations. It can cause you pelvic pain, and eventually it can even result into infertility. But that is schistosomiasis of the genital system. It is a rare condition because it occurs in those communities where water is infested. And sometimes it is missed even within the medical diagnosis. But when it is diagnosed in those districts where it is and where it can be suspected by laboratory findings, it can be treated. So we really must invest in ensuring that women access water, and I think the previous colleague has mentioned it. Water harvesting, but harvesting clean water is really a basic need for all communities. And therefore, we must make sure that we are part and parcel of the fight to climate change, which will make it difficult for us to access clean water which can be harvested. Otherwise, if we do not participate in these campaigns, in these strategies and processes and ensure their implementation, we will continue to be marginalized because women in their day-to-day processes become the #1 targets because they're the ones getting into contact with this dirty water. As you have heard, some of the women, while they are fetching water, they face various complications. Many of them have been mentioned. I just want to bring out that mentally, women are depressed when they are requested always to be the ones responsible for water, while their male colleagues, the young boys, or even stronger older men are left at home, playing football, listening to radio, putting up their legs. But the women who are pregnant specifically, I want to inform you that they have some specific risks. As you fetch water, you may slip and fall. And this sometimes makes women have pregnancy complications, and some of them are related to having miscarriages. The baby comes out, the pregnancy comes out when it's not even ready to come out because you've put too much pressure and weight on that uterus. A lot of weight encourages the pregnancy to get out prematurely. And so many times we also get premature dead babies because they're not ready to stay outside the world. But also when you skip and fall, there's a condition which can happen to your placenta when it is misplaced from the normal position. And this condition actually leads to many women dying when they bleed inside, and they are usually diagnosed late when they are severe anemic and in hemorrhagic shock. And by the time you relate the fall to that bleeding, you are actively in theater and you don't have blood and the woman is dying. So for us, women and girls fetching water is a health risk, which we must all always relate to. We must also recognize that water and sanitation services for us in the medical field are intrinsically linked to quality improvement efforts in the healthcare facility. And when we have scarcity of WASH, that is water and sanitation services, it leads to maternal and child health services, exposing women to infections and deaths. And this is true globally. It's not only in Uganda or in East Africa. WASH services, if they are not looked at critically, they lead to death and disabilities. So it is important that our governments critically work to achieve the water and sanitation facilities that we need in our health facilities, because this will help us put in place infection and prevention and control measures, which help us do our work, which we need to do in the health facilities. For instance, when you deliver in a health facility as a mother, you're supposed to have water to wash your hands so that you can breastfeed within a clean environment. Sometimes mothers fail to deliver and they need to be operated in theater. Theater needs a lot of water. And if there's no water, theaters cannot be opened. Some women have conditions like renal failure where you need renal dialysis. You need a lot of water to do even just one dialysis to clean up your kidneys which are failing. So if services do not have adequate water, some of the critical services we give to women cannot actually be done. But also women in health facilities for maternal and child need clean equipment. They need to be in a clean environment. And if water is not available, this cannot be achieved. You will recall in the recent COVID-19 outbreak, water actually became obviously important to the functionality of health services. And I think this was very obvious to everybody. And in fact, in some health facilities, it was reported that after some months of washing hands and making sure that we use water and soap, some critical conditions in maternal health care actually went down. Like the infections that we are talking about went down as a result of the infection control methods that were being observed for COVID. So water, sanitation, and hygiene services are so critical in providing quality maternal and neonatal health neonatal care in all our health facilities. There have been studies in the world, in Africa, in East Africa, to really determine how are we performing in regard to our water and sanitation facilities in our health facilities. And in 2019, a study which was conducted by both WHO and UNICEF really showed that hygiene was being practiced by only 65% of the health workers that were supporting 371 deliveries, majorly because some had water, they had soap, and they had a sink where to wash, but others did not have. So a whole third of health workers were not able to practice under hygienic conditions during childbirth and during the postpartum period. Yet, we all know in the medical practice that if we had proper sanitation, water, and practiced hygienic practices for the birthing surfaces, for the cutting of the cord for the looking after mother when she has delivered, it has a significant reduction of about 30% in regard to neonatal deaths. It also has a significant influence in how many women will get infection and how many of those will eventually progress to death. If we provide the proper hygienic conditions required by the health workers, then we reduce sepsis in many, or infection in many of our health facilities. In Kenya, Rwanda, Tanzania, and Uganda, in one study which had about 1,300 facilities, 30% of our health facilities which were surveyed in 2019, 30% had piped water in the delivery rooms. And yet the WHO recommendation, the UNICEF recommendation, is that we should have water points in our delivery rooms. Mothers and health workers should be washing their hands. They should be having functioning toilets, and they should be having clean pit latrines and toilets for mothers and their attendants after delivery. So 30% in Uganda, but 24% in Tanzania. So the East African countries are not doing well. And it is clear that we need to really work a lot if we are going to improve on the life of mothers, on the life of newborns, but also the conditions under which health workers work. Uganda is one of those countries which belongs to the 11 maternal and newborn quality of care improvement network, which subscribes to these conditions to be present at the health facilities. It also says in one of the standards which we have in our health facilities that we shall keep women for 24 hours after birth so that we can look after them and their newborns. However, in our recent survey, under the support of Rotary, it was showed that both the mothers and the attendants did not feel respected if they delivered in health facilities without water in maternity units. Because what happens is that their attendants are actually requested to fetch water from another source so that they can bring it to the mother and the baby to bathe. So they felt disrespected, although Uganda subscribes as a policy to ensuring that water is available in our maternity health services. We have also been asking them to stay, but one of the respondents said, so how can we stay for 24 hours without toilets, without water? So already when you are not having adequate water at the health facility, you are not respecting 3 standards of care for improving maternal health services in our country. Yet,
Dr. Olive, your time is running out.
In conclusion,
thank you. Thank you very much.
Attention to WASH services, water and sanitation in health facilities and their relation to quality improvement efforts has gained significant momentum. And I'm glad that this is one of them. There has been an extensive multi-country review of WASH services, as I've said, and many countries are now subscribing to it and their national policies and standards in relation to water and sanitation for health facilities, which therefore we should be advocating and encouraging partners, funders, governments to implement them. Because it's not the lack of policies, as you will always know, Uganda, it is the inability to implement what we are supposed to implement. And in this context, again, WHO and UNICEF have committed together with partners to improve WASH services. And they have launched a global action plan with a vision to ensure that by 2030, we are in 2022, we have only 7 years to ensure that all healthcare facilities have got hygienic facilities and practice to meet staff and patient needs in order to provide the safe, people-centered care, as you heard the attendant complaining. And this is in particular attention to the needs of women and girls. So we call upon the NGOs, women groups, district leadership to really take this actively, play an accountability role to ensure that water, especially in MCH-related services, is actually available to reduce morbidity and mortality due to infection and sepsis, which results into these deaths and disabilities. We have therefore to look at all the possible water harvesting and cleaning strategies and ensure that water is actively available where it needs to be as a critical component of quality services. And therefore, we also subscribe climate strategy to keep our climate so that we do not lack water. Thank you very much for giving me this opportunity to link water availability to maternal and child health services. Back to you. Thank you very much.
Thank you very much, Dr. Olive, for compacting so much in so little time. Thank you very much for sharing of your work. And in case we have any questions or comments, please feel free to use the chat section. But in case you would like to ask Dr. Olive, now would be a good time to put up your hand. But in the event that we don't have any hands in the next 5, 4, 3, 2, 1 seconds, we will move on to our next panelist. And if the questions that you would have wanted to ask come up, feel free to drop them into the chat section and we will be able to get back to them if time allows. Joining us is for our next session is Dr. Roswitha Kremser, and I hope that I have pronounced your name well. But Dr. Roswitha is currently the head of coordination for development cooperation at the Austrian Embassy. And she has served amongst others as the deputy head of cooperation for the Austrian Development Cooperation in Mozambique. She's also served as a senior expert for public administration at the Austrian Development Agency. In the around mid-2012, she joined the United Nations and worked in Burundi with a focus on good governance and political affairs. She holds a PhD in political science from the University of Vienna, a Master's of International Relations from the University of Kent, and a Master of International Commerce from the Vienna University of Economics and Business. And today, Dr. Roswitha shall be joining us to have a conversation on the role of development partners in financing for water and environmental conservation for sustainable development. And for anyone who is joining us from any of the developing countries, we know that we cannot understate the role that development partners have played in ensuring that there is availability, but also accessibility to clean water. And going on, I believe that there's a much bigger role that they can continue to play. And I believe that Dr. Roswitha will be able to point out much more on that subject. You're very much welcome. Thank you, and over to you.
Thank you very much, moderator. I hope my voice is loud and clear. Okay, perfect. Thank you very much. First of all, let me state that it's really a great pleasure that I was invited to be presenting the role of development partners here in financing for water and environmental conservation for sustainable development at this side event of the 66th session of the Commission on the Status of Women. And I have to say, as Austria, we are one of the very active partners in this commission, and I'm really pleased, and I've just also gotten the messaging from Vienna that we really are pleased to be active so much in this session, and of course also including on this specific session on Uganda, trying to interlink women and access to clean water. I don't want to repeat a lot what has been already said. We know that water is fundamental, and I subscribe to everything what had been said by the previous speakers. We need it for food, we need it for energy, we need it for health, life in the cities, social stability, and everything. But today we have to go beyond the normal. Actually, when I listened to the previous speakers, we were not yet getting at the level of urgency that this problem has reached. Water scarcity today is at the level of a global threat. We have a rising population growth. We have the industrialization and agricultural intensification. We have urbanization. We have the pollution of water sources, and we have unsustainable demands and pressures on the world's clean, fresh water. So when we want to detangle the complex linkages between access to safe water and now what has not yet been mentioned, climate change and gender transformation, we are really looking at very daunting pictures. We have on top of this, the overwhelming number of environmental catastrophes on particularly this very beautiful continent, Africa. We were just facing flooding of Lake Victoria, the rapid disappearances of forests, and we had, of course, the terrible effects of COVID-19 on the already very heavy role of women and girls as notably the key unpaid caretakers for ensuring that water is there and safety is there in the households. So it's truly high time to bring the gender aspects on the right to clean water more to the forefront on the debate of access to clean water, particularly on the African continent. For Austria, I have already said it and I want to say it again, as for many other development partners, the advancement of gender equality and environmental protection both feature very prominently on our agenda, and environmental protection is actually amongst our top three global priorities. But when we had the chance to discuss climate change initiatives ahead of the COP26, we saw that the gender issues were not yet sufficiently considered. And a greater focus, as I already said, must be put on the linkages between environmental protection, gender mainstreaming, and continuous sustainable development, so that we can all achieve the sustainable goals. When it comes to the access to rights, the human rights of access to water, it was in already 2010 where the UN General Assembly explicitly recognized this human right to water and sanitation and acknowledged that clean drinking water and sanitation are essential to the realization of all human rights. And we can never forget that some of us, we don't think about anymore when we get some drinking water and we just drink it, not considering that some other women, maybe not that far away, need 6 hours to get that cup of clean drinking water. I think we really have to think about this much more. And when we look at the statistics, we know that up to almost 800 million people do not have access to an improved water source, or even are dreaming only of a piped household water connection, something that some of us would not even consider thinking about anymore, what a life would be without it. And I'm particularly looking towards the colleagues in Geneva who might also be watching. So when we look at the specificities of Uganda, We are actually very encouraged that Uganda's National Development Plan 3 identifies the provision of adequate water supply and improved or a healthy environment as one of the key priority areas for promoting sustainable wealth creation and inclusive growth. The figures for safe access to water, and I'm sure the colleague from the Ministry of Water will come to it in more details, they vary from about 69% to 79%, depending on where you are in Uganda. But that leaves out 30% of the people who don't have access to clean water. And the situation is much more dire when it comes to access to sanitation. We have just listened to the very passionate reply or request for more support to access to clean water and sanitation from our colleagues from the World Health Organization. So when universal access to safe water and sanitation is to be achieved in Uganda by 2030, what really still needs to be done? On top of this, let's not forget that Uganda still faces a strong pressure on water due to the high annual population growth. We have not yet discussed this, as well as the high refugee influx and a high rate of non-functionality of water points. It's for all those factors, but particularly also because of the very positive approach by the Ugandan government, that we as Austria, as our many other development partners, are committed to contribute to improving the situation in the sector. When we look at Uganda, we note that there is actually a quite high number of development partners and donors that are supporting the Water and Environment Ministry. And though we note that also recently there was a split into different governmental programs. So the Ministry of Water and Environment is now split between 3 different governmental programs, and we will see how this will be encouraging or discouraging further progress. And as the discussion on this is ongoing, how to consolidate maybe those splitting of the duties and programs and activities of the governmental institutions into the different programs. How is this promoting progress is yet to be seen on the ground. So currently in Uganda, we have about 25 development partners who support the Water and Environment Ministry. And when we look at the national budget allocation for Uganda, Uganda has committed 4.5% for water and environment in this year. And this is a significant increase from 2.7% previously. So, how does it come to this massive increase is what we have to also analyze in more detail. So I say again, this is a more than 1 percentage point in the budget from one year to the other. And that is really significant. We have to congratulate Uganda for this. But when we analyze it deeper, I already see Isabella is clapping. But when we analyze this deeper, we have to understand where does this come from. And we have done this analysis rudimentarily already, but we are looking into a more in-depth discussion with the ministry. So this increase is actually majoritarily coming from donor funding. Now, you ask yourself why, and you, not by coincidence, know that the COP26 has just been finalized. So in 22, when we look at this, donors will be funding a whopping 65% of the program of the government of Uganda that is focusing on natural resources and the environment. And that means that only 35% of the program is from the own resources of the government of Uganda. So while we have to certainly say that donors are trying to abide by the commitments that all of us have done during the recent climate change negotiations in the COP26, we have to now also ask ourselves, what about the sustainability of all those activities for the future? Now, of course, we see a lot of important activities that are also done by the government of Uganda in striving to deal with the negative effects of climate change and the COVID-19 pandemic. And for example, very significant policy campaigns, such as the National Campaign Against Teenage Pregnancies or Violence Against Women, because many, as we heard by the previous speakers, those the violence against women and girls during the COVID pandemic happened particularly also during the time that they had to go and fetch water, and that glass of drinking water that everybody of us needs. So we can't de-link violence against women and girls and access to clean water for sure. We also see a clear leadership of the government in the policy discussion. And so, as a donor, we have to say we would hope that this political leadership also translates into more domestic resources of our partner countries for clean water, access to sanitation, such as, for example, Uganda. Finally, I have to also say that one particular aspect was not yet touched in the discussion. And as we have seen that this very interesting session is being discussed by our long-term partner, UWONET, we have to also applaud the contribution of the civil society to access to water and sanitation in our partner countries. And as we, of course, particularly focus now on Uganda, we have to notice this. And without CSOs like UWONET or UWONET and others, where would we be in advocating for equitable access to water, safe and clean water, sanitation for women and girls and vulnerable in our countries? We have to, and I want to say, in addition to all those recommendations that have already been mentioned, we have to therefore make the civic space and associated rights, such as the right to assembly and association, a continuous key issue of our advocacy. We know that for the individual woman who, again, I come to my example of that lady or that maybe young teenager girl who has to go 6 hours to fetch the drinking water for her family, does she has the access to speak about her cumbersome 6-hour journey every day? I don't think so. So we need a strong legal framework and a sufficient space for NGOs to advocate loud and clear on behalf of all these vulnerable, also the women and girls, and that is on their behalf. Therefore, we really want to thank UWONET for having organized this discussion today. And I can't just close without stating that, of course, as Austria, as many other development partners, we remain fully committed to further increasing access to clean water and sanitation in our partner countries. And by doing so, we know that access to clean water is predominantly a female task in our partner countries. So by definition, also we want to advocate for more gender equality and better access to all rights, not only clean water for women and girls. Thank you very much.
Thank you very much, Dr. Roswitha, for your kind remarks, but also for reminding us how political water is. I think as a people, very many times we divorce the issues of access from from governance discussions, but also divorce the issues of access from conversations around the right to assembly and the freedom of speech, which are key, which are key elements. So usually when you go to communities, and I speak as a Ugandan, you'll be told, no, don't bring politics into water, don't bring politics into this, and yet it is a very political conversation. And at this time, I would like to bring in, another panelist who is, she is a lawyer. She is also a member of FIDA. She works at FIDA Uganda. But more importantly, when Dr. Roswitha was talking about water and space and voice, I remembered that she's also a feminist who believes in feminist politics. And so the discussion around water, I believe, will be more vibrant, especially from the feminist lens. And this panelist will be talking about interrogating the gender responsiveness of the national legal and policy frameworks, how they influence women's equitable access to water. The panelist that I am talking about is none other than Miss Elizabeth Kemigisa, who is a fervent feminist and human rights lawyer with 6 years of substantial experience in project planning and management with national and regional non-government organizations. Elizabeth uses feminist tools of analysis to examine and understand systemic political, social, and economic injustices and their manifestations, with keen interest on the intersection of economic exploitation and gender oppression. Her core particular experience revolves around organizing leadership trainings, spearheading advocacy initiatives, undertaking research and social media engagements, and policy analysis. She has quite a bit of experience up her shoulder, and she's been part of the team that, for example, conducted research on the status of the East African FGM bill and the anti-trafficking bill, sexual offences bill on the rights of sex workers and LGBTI persons. She has also done a bit of work around the prevalence of intimate partner violence amongst the LGBTI community under the Femme Alliance, as well as so many other interesting things. So without wasting time, I'd like to invite Elizabeth Kemigisa. And I hope she's on the call because she kept oscillating between the waiting room and the conversation room. So Elizabeth, are you on call? Elizabeth? At one point, I encouraged Elizabeth to find a tree and go up it just in case the network in Uganda had become a problem. Elizabeth, are you on call? Okay, so it seems like after introducing Elizabeth with all the energy, Elizabeth is not here. And so we will go on and go into Mr. Joel Chiwanuka's session. And Mr. Joel Chiwanuka is a principal sociologist with the Ministry of Water and Environment. And he will be talking to us about integrating unpaid care into government policy, planning, and resource. And even as Mr. Joel Chiwanuka comes on board, I am reminded of the last national dialogue that we had where one of the stakeholders in the room said that with the advocacy work that the Uganda Women's Network was doing, it was going to cause an increase in divorce rates and cause marriages to break down because we were attempting to go into the territory of unpaid care work, which he said was a duty of women. And so I would love to hear on how from your perspective as into government policy, planning, and resource. Over to you, Mr. Joel Chiwanuka.
Okay. Hope I'm audible enough. Can I share? Okay, let me try to share. Unfortunately, host has disabled participant sharing the screen.
Just hold on a little bit. They are going to give you sharing rights.
Okay.
Yeah.
Okay. Let's see.
You can now share.
Okay. Just a moment. Sorry about this. Sorry. Is it visible now?
No.
Not yet. Let me try again.
Now it is visible.
It is. Thank you very much.
Thank you.
Yeah, I'm sharing a presentation on our experience integrating unpaid care. I would also like to join others in thanking UWONET for organizing this, and for all the participants, especially the panelists, for highlighting very pertinent issues, and they've in fact made my work very easy. Of course, as an introduction, we already mentioned water as a human right and economic resource, and of course, which is very crucial for human existence, economic growth, and development. And as you might agree with me, all the SDGs we have, in a way, have a connection to water. And of course, within our economy, we see water linking very closely with all other sectors, health, agriculture, tourism, education, transport, energy, and of course, it's also very crucial for environmental sustainability. But as you might also be aware, SD6, which is on water and sanitation, aims at ensuring that we have 100% access to clean and safe water by 2030. And our national development plan is looking at a target of about 85% specifically for rural water. But maybe I know of interest to this meeting is where are we now when it comes to achieving these targets. Regarding rural water, as you might be aware, we are at about 68%, and we've stagnated for the last 3 years. Of course, this is due to a number of reasons, which include the fact that we have a high population growth of about 3%, which translates to about 1.5 million people every year, of which with the current funding, as a sector, we've only been able to serve approximately about 1 million people each year. So, which present a very significant gap when it comes to providing our people with water. But of course, the other challenge, as Dr. Kremser mentioned, was the functionality of our water facilities, which is largely due to the aging infrastructure. Many of the infrastructure we have, especially in rural, have been supporting us for almost close to 30 years. And they are frequently breaking down. Now, with our population of about 47%, we still have about 15 million people who are currently not served, which presents a very significant population, a big population of people that are still yet to be served. And analysis of villages in Uganda, we see that out of the 57,000 villages we have, only about 18,000 actually not served. So you see that we have a big challenge here. And again, when it comes to coverage, much as we are saying we have an average of 68%, we also have districts that actually have only 31% coverage. Districts like Vuma, Chegegwa, Kakumiro, Raka, Ikazo actually only have service of about 30%, which actually presents a very big problem. So of course, the question is what is the implication on this limited accessibility and availability of water, and especially on the topic today on unpaid work. Of course, it presents an enormous burden to girls when it comes to collecting and managing water supplies. Our studies have shown that our girls and women spend about 6 hours every day collecting water, especially more so in the districts that are unserved. And of course, the situation is all over Africa, but we see our girls carrying heavy loads over long distances and sometimes difficult terrains, resulting into strained backs, shoulders, necks, and other injuries. I think Dr. Olive articulated very well on these ones. And of course, our girls are carrying and women are carrying their water on their heads, which is actually very inhuman. Of course, there are quite a number of aspects or issues that have been discussed, but in conclusion, we see that all the above weighs disproportionately on women, and it puts an extra load on them. And of course, this means that we're having our girls and women having less time in education preparation, skills development, and gainful employment, and they cannot even attend to leisure activities. Of course, these present a very big handicap to their progress. So, of course, if I may go to the major issue of this discussion, maybe how is government assisting in planning and maybe resourcing? So the water sector appreciates the fact that the heavy unequal burden of unpaid care on women and girls is driven by social norms, policy and social institutions, economic environment, and the technology and infrastructure that does not favor our girls and women. And most of our interventions are actually targeting lifting constraints that have to do with women spending a lot of time collecting water. So we are looking on how best can we reduce the burden borne by women, and then how best can we redistribute responsibilities between women and women. And in this regard, we are undertaking a number of interventions. Now, what are these interventions? Now, as government, for all our policies, be it water policies, be it environment policies, we're ensuring that we integrate gender. And then secondly, we've also developed a number of guidelines, especially for community engagement. And I know many of these are being used by NGOs, including UWONET. And again, these are trying to ensure that women participate and maybe reduce their burden. But we also have gender-specific strategies for water and environment. which again clearly indicate ways through which as a sector and maybe the ministry and the partners, we can be able to integrate gender into all our work. We are also undertaking gender and equity budgeting on an annual basis. And I must report that the water environment sector has been one of the sectors that has been performing quite well when it comes to allocating resources based on equity and based on gender considerations of the marginalized and the vulnerable. So we are also doing a lot of capacity enhancement of our stakeholders, and we are also doing we're also promoting a gender sensitive work environment whereby we are putting a favorable work environment for women, including the fact that when we are doing recruitment, we try as much as possible to give a special status and even more points for women, more so engineers who express interest in taking on employment with the sector. But we also put in place committees that try to protect women within our organization because we want to ensure that our work environment is safe. Most important, we are trying to promote affordable technologies, technologies like solar energy and technology for gravity flow schemes, because studies have shown that these have low per capita investment costs and low operation costs. And of course, these lead to better access and can be time and energy saving and maybe more affordable to our communities. Now, within many of rural areas where we have water points, we've also started a program whereby we try to improve on the technology, maybe by installing solar systems, and where we also put a tank and try to ensure that we have more delivery water points at a water source such that we could reduce on the time taken by these women collecting water, but also improve on access in general. We've also been promoting rainwater harvesting over time, together with a number of NGOs in the sector. And this is basically domestic rainwater harvesting, where we believe that by having water within a household, it can really save time and maybe also improve on the cost of service delivery. As a sector, we're also doing some economic empowerment and skill development. This is whereby we train women in constructing of rainwater harvesting tanks. We've also trained women masons. We've been training women in manufacture of energy saving stoves, manufacture of soap, and other products. Of course, this is aimed at improving their incomes and then reducing maybe on the time on other unproductive activities. Of course, UWONET clearly articulated the fact that all our water management committees are women, and our guideline is that at least for these committees, 50% of the people should be women, and then women should also occupy key positions. And this extends not only on water management committees, but also on water management, resource management committees, and also environment committees, because we believe in this way we would be promoting decision making, and then of course also improving power relations within these communities. We, as a sector, for all major projects, we also do environment and social management studies to inform decision making. We also do socioeconomic surveys to support service delivery, because we believe with these surveys, we can be able to know where water infrastructure or water networks may better serve the people who need services more. We are doing a lot of collaboration with partners, including NGOs and private sector. And of course, I'd like to thank all NGOs that are supporting us with advocacy. Of course, there is increased allocation to the sector. Of course, they're also supporting us with funding. In our sector performance reports, we see considerable contribution of NGOs when it comes to funding for the construction of water facilities and operation and maintenance and also software activities. NGOs are also helping us on community engagement, research, and innovation. We are also promoting a policy of pro-poor, where we've constructed water systems in towns. We ensure that at least we have water kiosks where water is more affordable than daily connections within homesteads. Again, this is aimed at ensuring better access and affordability for our women. Of course, we also have a requirement to have gender experts for all water development contracts and consultants. Again, the purpose is to ensure that the needs of women and other vulnerable groups are actually well catered for within these contracts or consultants. I think that is it. Thank you very much for listening to me.
Thank you very much, Joel, for your submissions. I would like to ask the UWONET team if Elizabeth is with you now, because if she's not with you, then we will go into closing. Okay, so it is not say questions, or do you have any questions or comments on missions made so far?
Isabella?
Yes, Sheila, please go ahead.
Yes, Elizabeth is joining us shortly.
Okay, while UPF Wash, you have your hand up if you want to submit.
Yeah, good afternoon, Ms. Jacqueline. I'm sorry I joined in last bits of Joel's submission, and I would like to only acknowledge that we are so grateful for these efforts, especially for accessibility and affordability of water. And we are willing to work with you, Joel. This parliamentary forum is an advocacy forum in Parliament, with members of Parliament who have passion for WASH. Are we on this conversation team? Thank you so much.
Thank you very much, the Uganda Parliamentary Forum. Do we have any other questions or comments as we wait for Elizabeth to join us? And yes, the presentations will be made available to participants. Okay, so I have been informed that Elizabeth will be speaking through the UWONET account. Elizabeth, I had already invited you and I had already introduced you. So please go ahead and submit, given that we have approximately 11 minutes to close today's session. So over to you, Elizabeth.
Hi, Isabel. Sorry, my internet today has been very skippy. I've had to move 2 locations before I came to UWONET, so apologies on that. Since I had a bit about the first beginning of the submissions on the discussion of that day, and I missed a bit of it, so I'll try as much as possible to keep my pointers within the next about 5 minutes, since we are almost out of time, but also to avoid maybe repetition for some of those issues that I might have missed in the start. I'm supposed to speak about the gender responsiveness of some of the policy framework towards women and water, the relationship between women and water, but also our policy framework. And since I do only have 5 minutes, I will not bore you with the details of the different policies and what they say. I think that's something that we can easily get hold of, but I'll just give my reflections on what my thoughts are on the relationship between policy, women, and water. I had campaigns, community campaigns on curbing the problem. And one of those messages that were key from the Ministry of Health were on washing water, making sure that you wash water for a particular number of times to ensure that you're clean and that you're not spreading that disease. But around that time, my major reflections were, at no point did the Ministry of Water, for example, or environment, or the government itself through its major communication channels, come out to perhaps reduce the cost of water. I do not know if anyone in their communities had that as a concern of the government. And that shows us on how somewhat uncoordinated government responses are. We do understand we were dealing with a virus that was unprecedented, and we were, like other countries, grappling with it and responding as we were learning. But I think that was straightforward, the fact that water was being used a lot more than every day. But at no point did the Ministry of Health or Ministry of Water come out to even give any directive that maybe water, a jerry can of 20 liters that was originally 500 shillings will now be to encourage Ugandans to wash their hands and keep safer. Now, what this meant was that water continued to be the same price, right? But remember, we are talking about many women who are in the informal sector and many families that are depending on these women whose income had even been cut down further within that period. I remember we had a survey in about 8 districts where we operate, and many of the women in there were saying water has actually become more expensive at taps, at general taps in communities where people go and queue, for example, to get water, right? So you had to therefore go and use the public spaces, the boreholes in some of the rural areas. But for the urban poor, in quote unquote, Ugandans in peri-urban areas, they had to deal with an increase in the cost of water. And that was ever addressed in any of our conversations on COVID-19 response. Then the other reflection that I'd like for us to maybe take away from this side event is on, I think, what the second speaker spoke about, the fact that we do have a lot of support from development water and others. Now, I'd like us to link this conversation to the fact that to the problem that we are dealing with therein. Education has become extremely expensive, health has become extremely expensive. We are treating those critical services for basic survival as commodities in the market. Now, my general fear and what I'd like for us to reflect on this is water continues to be like as education, health and housing and etc. Do we want to wait for a situation where we do have major funding for water, accessibility, maintenance, and responses to water scarcity coming from development partners, like, for example, some that may be on this call. We have seen the African Development Bank support a lot of work on access to water, especially for young girls and families in rural areas. Do we want to continue with that trend? Because we see the problem with that. Without using wrong language, do we want to continue as CSOs in collaboration with our development partners, usurping the power of the government to continue providing these services? We want to think about the role we play to have it be as complementary as possible. That way the government does not have to give up its critical role of providing these services and leaving it to civil society, development partners, and depending mostly on aid, because we know the challenges with aid in countries that are in the global south. And then lastly, is on interrogating issues that I think everyone has spoken about, accessibility, especially on how that differs between men and women, but between different communities and people in different locations. In Uganda, a lot of our efforts as civil society have been focused on people in peri-urban areas of late, but mostly in rural areas. And I know it's because of the different researches that we've done that show that most people in the rural areas continue to grapple with these problems a lot more than those in the urban centers. But I think from experience, and I know that UWONET has done this work even at a broader level than FIDA, where I come from, you will see that when we speak about water, people in urban centers continue to struggle a lot more than even people in rural areas. But even the challenges that the teenager in a park faces to access water is different from one that a teenager in Kampala, for example, in Bwaise, faces. So that's something that we start to look at as a society, so that we not concentrate our resources mostly in rural areas, because that's where we mostly worked because of their different challenges. Do we want to pay more now attention to the differences, to the intersection, and like really a feminist lens in how we deal with accessibility to water, affordability to water for especially women and young girls? Yeah, so that's where I'll leave it at, especially now that we only have 3 minutes to one. I'm sorry again about my network, and thank you very much for still providing the space for us to have this conversation on it.
Thank you very much, Elizabeth. Oh, the point have been made thus. Any comments or questions? Okay. Since we don't have any comments or questions, we will go to we'll go to the chat section. A lot of the conversations in the chat section have been around 2 issues. One is on introduction, so thank you very much for introducing yourselves. And the second theme in the chat section has been a request for content. UWONET will make sure to share the presentations that have been made today, unless there are caveats of the presentations. But if there are none, they will be shared with you. Alex Ahumuza says, thank you all for your great presentations. I think significant investment is still required if we're to realize the World Health Organization standard of 30 minutes round trip, including queuing time as well as per capita household consumption. This will reduce, increase savings, reduce abuse of women and girls, etc. And I agree with you, Alex. Jocelyn has Joel, and she says, thank you, Joel. Very brilliant. Your presentation will note that there are a number of gender policy provisions and initiatives, which is really good. Well done. Would you please speak about how the social norms that greatly impact on water accessibility issues?
Okay, can I go ahead, please?
Yes, please, yes.
Okay, thank you, Rosaline, for that question. Of course, as I indicated, social norms and beliefs actually usually affect most of the participation of women and girls, but also there's a way affect access when it comes to water points. But as a ministry, what we do is for many projects that take a special economic survey, or in some instances, environment and social impact studies. And the purpose is to look out for storms, beliefs, issues, violations, issues maybe pertaining violence that could be the reason may be responsible for women. We look out for ideas, most so for because of that, since they are the people who normally go out there to fetch water, they normally have more information regarding maybe, but they could also have a lot of information to do with the how. So we'll start and for those of you who also have had a chance to look at our guidelines, you see that we guide our people, our technical officers in the districts on how best to approach these situations, and generally encourage the participation of girls and during our project. Thank you.
Thank you very much, Joe, for your submission. And I know conversation is one that keeps coming up even in the dialogue discussions that UWONET has been having. And it's not just with communities, it's even with technocrats, it's with leaders, it's everywhere. And I thank you for submitting on that, but I also think that in addition to training us on how to do this at community level, I think is a conversation that should also make its way through the different corridors of power, both in the ministry level. On behalf of the Uganda Women's Network, please allow me to say a big thank you to each and every one of you for sparing the last 2 hours to be part of this conversation, where we're discussing women, water, and the care economy as a event on the as part of the conversations happening on the Commission on the Status of Women. And I hope that we have all learned a lot, and I hope that we can continue to online, on social media, on how the issue of access and availability can be made a reality for women and girls. So without wasting any more time, I would like to wish you all a great reminder of the day. Remainder of the day, but also even as you leave, please don't forget to use the link that has been shared in the chat section to register your participation. To our panelists, that is Dr. Rose Witter, also our panelist, Miss Elizabeth Kemigisa, Dr. Olive Sentumbwe, our panelist, Mr. Joel Chiwanu Agwang, who is the Director of Programs of the Uganda Women's Network. Thank you very much for sharing your knowledge with everyone who was part of this match, and have a beautiful remainder of Women's Month. Have yourselves a good to all. Cheers.